Hello everyone, this is Dr. Khan, Executive Plastic Surgery, Bloomfield Hills, Michigan. So I've just completed what is a 100% total capsulectomy, 41025, initials MP. She had 3 sets of implants. The first one was 1997, second one in the year 2006, and the third one, the silicone one, from 2010. So this is her 3rd set. So she had what is a grade 4 capsular contracture on the right side. And as you will see right here, if you come, you will see that this is capsular contracture, 4 grades, Baker's classification, grade 1, grade 2, grade 3, grade 4. So in this case, we look at the breast implant and then implant. In this case, the patient had grade 4 capsular contracture. So the breast was deformed, it was painful, and the implant was not, basically it was visible. The implant was visible, and the implant was also palpable, yes. So yes. The normal one is grade 1, where the breast is soft, the implant is soft, and the implant is not visible or not palpable. And then you have the 2 grades. The grade 3, grade 4, the big difference is the painful part, and that essentially differentiates between the grade 3 and grade 4. And grade 2, where you have what is a breast is solid, implant is not visible but is palpable. So in this case, she had pain on the right side and she had a deformity on the right side. And what's interesting about this patient is, you know, she's a lady that had juvenile rheumatoid arthritis, so JRA, juvenile rheumatoid arthritis, diagnosed at grade 4. She should not have gotten her implants in the 90s, 97, 2006, or 2010, because anyone who has these underlying rheumatological problems like lupus, or someone who has had a kidney transplant, someone is diabetic, these patients are not candidates for what is breast implants. So her surgeon should not have offered her, given her underlying juvenile rheumatoid arthritis, implants, and it is contraindicated. So as you will see on the right side where the end block was done, you will see the complete total implant capsule removal, and she actually had an MRI done, and she chose to do it on her own, and she defied the many other subspecialists that she saw. And as you will see, complete end block, so everything contained, none of this spilled into the chest. As you go in and look, you will see this is the cartilage part of the rib right here. This is the cartilage part of the rib. This is how it was sitting literally on the chest. Everything contained, and a very large implant for the patient's chest. And it was a very tedious dissection, so you can see the cartilage part of the rib. You can see right here, again, the cartilage part of the rib, again here, rib, rib, rib. And all done in what is end block, all bad tissue, inflamed tissue removed, only good healthy tissue remaining behind. This was a very tough dissection. So as I go in, you will see that all of the bad tissue was removed. There was also Ethibond suture that was noted, and we're going to see that on the other side as well. So as I go in and remove, I cut this capsule out, you will see this tissue. I just want to go ahead and take the time to show this tissue that's right on top. This is angry, it's inflamed, it's bad, and it is part of the culprit. So in my practice, I remove it as well. It's a small amount of volume. You don't want to leave this behind, because then you leave the disease behind, because as you can see, this implant cut this open. You will see she got herself what is supposedly the gummy bear implant. So I have this, I'm going to actually move this out of the way here, and I'm going to toss this away. So this is supposed to be your gummy bear implant, the nicer, better, safer, ever since introduced in 2007. And as you will see, it's going to spread out, all contained. So as you will see, none of this spilled into the chest. And if you see my green glove, and if I put it right on top of the ruler, you will see the markings. It says inches, 1, 2. And so the bottom line here is that it is paper thin, yes, but it still needs to be removed. Done in the end block fashion. None of this spilled into the chest. I challenge anyone to say if this is cohesive. You know, it just wants to, it's like molten honey, and look at the way how it's going to spread out in the next several minutes. So all contained. Let me look one more time inside. I just look for, so you can see again, look how thin this tissue is. You can see my green glove all the way around. And a significant time was spent doing this, as you can imagine, in the en bloc fashion. So she got the best surgery anyone could have offered her because it was all contained and all bad tissue removed. And look at this, none of this built into the chest, and you can see it is ruptured. So what I'm going to do now is I'm going to go ahead and remove my top sterile glove, and I always like to do it with sterile gloves in case there is any liquid. I want to take cultures of it. I do not want to use nitrile non-sterile gloves. So this is on the left side. I cut out the skin. Per MRI, we know this is not ruptured. So I'm going to go ahead and cut this open, and you will see the difference. This is your cohesive implant. Again, very thin capsule underneath the muscle, right on top of the rib. This is very challenging surgery. And as I go ahead and pull this out, you will see, look at some of the fluid. So what's interesting is, look at this. It's starting to rupture. So look at this right here. So if you look at this one right here, this is clear. This is what is starting to disintegrate. So look at that one right here. And so overall preserved. This is your Mentor 500 cc implant. And as you will see, and again, all like a focal area of what is on the side. And I will tell you, this is a contained focal rupture. And again, you will see, look at my green gloves, very thin capsule. No matter how thin it is, it has to go. So the bottom line here is that the implant capsule and all of that inflamed tissue is completely, sincerely, definitively removed. In this case, underneath the muscle, directly on top of the rib. All bad tissue, inflamed tissue, implant capsule is removed as one system. En bloc, as you can see, such that none of the silicone spills into the chest. All of this capsular tissue is then going to be sent to pathology, rule out the rare BIALCL, the very rare BILCL. Implants will be returned to the patient, cultures for aerobic, anaerobic, and fungal, and most importantly, we'll see how the patient does minus her grade 4 capsular contracture. And again, if you look at the color of this implant, and look at this implant, how it's kind of literally melting. There's nothing cohesive about this implant. It's not the gummy bear anymore. And literally, as you can see, it is, after some time, you're going to see it's going to spread out because it's going to essentially leak out. And you can imagine if the patient is moving her arms around or exercising. So one patient called me that I talked to over the weekend. She had an MRI proven rupture. And so you can imagine if this is sitting on the chest and she's moving about, exercising, riding a bike, riding a horse, or falling down, basically on ice, you can imagine how she can disrupt that capsule, and then this can now be an extra capsular rupture. So the goal here is, once you know there is an urgency, it's not healthy to have what is a ruptured implant, and the goal is to do it in the manner as described. So this is the con procedure. This is how I have consistently done it. So this patient has done extremely well given her age and presentation, minus the unnecessary lift. The implants will be returned to the patient, capsule sent to pathology, rule out the BILCL, cultures for aerobic, anaerobic, and fungal. She's going to get the high definition pictures and videos of the chest wall showing complete removal of the capsule and implant and all inflamed tissue, and certainly this Facebook Live. She got the twilight deep sedation, and no matter what, she got the same surgery that I offer to all the patients, so that when we look back, a complete thorough workup was done. Number one, all of that implant capsule inflamed tissue was removed, and number two, all of it was tested. So there you have it. This is Dr. Khan, Executive Plastic Surgery.